Dr. Jeff here with you again today. Today our topic is carpal tunnel syndrome. So we're going to talk about some causes and some treatments for carpal tunnel syndrome. Carpal tunnel syndrome is classified as a repetitive strain type of injury. It usually comes from overuse of your wrist and your arm. There's many causes, but too much typing or mousing, driving, anytime you're overusing your wrist can cause carpal tunnel syndrome. It's not pain. You don't get pain in your wrist. A lot of people come and see me and they got pain in the wrist and they think they have carpal tunnel syndrome, but it's more of a tingling and numbness and pins and needles type of thing. Usually begins in the thumb, moves into their first finger, second finger, and finally into part of the fourth finger, about half their fourth finger, as you can see by the picture. The median nerve actually starts up in your neck, runs down through your arm and goes underneath a ligament called the carpal ligament. Now what can happen with too much use is that the tendons that are running through this tunnel with the median nerve get all swollen and fill up the space. And that puts too much pressure on the median nerve, and that causes the pins and needles and tingling that you'll get with carpal tunnel syndrome. So a lot of people find with this in the early stages, they might happen at work, but then eventually at nighttime they'll start to wake up with pins and needles in their hands. They have to shake it out to try and get the feeling back in it, or they start driving the car or reading a book and leaving their hand in that position. Causes the pins and needles in their hand. So next we're going to talk a little bit about what we can do about carpal tunnel syndrome. When it comes to the treatment of carpal tunnel syndrome, you really have two options. Option number one is surgery. With surgery, they basically slice open the carpal ligament in your wrist, let the pressure off, stitch you back up, and takes the pain away and relieves the tingling and numbness in the hand. That's about 72 to 74% successful. The reason for that is that the median nerve actually begins in your neck. It comes from a bunch of nerves up here that runs down through your arm. And it can get pinched anywhere going down through your arm through some muscles in your arm. So here at Goldsworthy Wellness, what we do here is we actually will look all the way down. So we look at your neck, we look at the muscles and where the nerves are actually traveling, and we do some active release therapy to try and, almost like pulling a thread through a needle, trying to release that nerve as it's coming down. The big thing we have here is called the Carpal Tunnel Distraction Machine. This is one of 12 machines ever built, designed by a chiropractor to treat carpal tunnel syndrome. And what it simply does is your arm is put in the machine and we actually just tug it in 3 different directions. So we're pulling it straight, pulling it this way, and pulling inside. And the idea is we're trying to stretch the carpal ligament to create more room underneath the ligament to release the nerve. It's about 88 to 92% successful in treating carpal tunnel syndrome and getting rid of the pain. But again, we also look at everything going down the arm as well as doing the machine. Once we're done with the carpal tunnel distraction, we actually put you on cold laser therapy, which is an infrared light that goes and it works very well at helping mitochondria repair themselves. We find the combination of carpal tunnel distraction, ART, and cold laser therapy is very successful in treating carpal tunnel syndrome. If you have any questions about carpal tunnel syndrome, you can always email me at Goldsworthy Wellness, jgoldsworthy@goldsworthywellness.com. You can send an email, or you can always book an appointment and come in and talk about it. I'm Dr. Jeff. I've got your back.